Hi, good afternoon. I'm
Good good afternoon.
connected earlier.
Sure. Warm welcome to you we on behalf of APAC News Network. APAC News Network is a media organization headquartered out of Noida, and our focus domains are government, healthcare, education, IT, enterprise, and BFSI. So primarily, the discussion we want to like, and maybe best would be if you can start with the solutions that Edwards offers, especially in terms of the critical care support and the other solutions, and maybe their use cases.
Okay, sure. I think as you're aware, Edwards Life Sciences is, I want to say, it's a specialty medical device company, right? And we primarily focus in two areas. Okay, one is, we focus in critical care medicine, as you mentioned, and the other we focus in structural heart disease. And then in critical care medicine, we focus specifically in hemodynamic monitoring. Okay, and so what that is in hemodynamic monitoring, in a nutshell, is monitoring, how our blood flows within the body, right? And that's what critical care monitoring does, right? So it's predominantly suited for patients who are very sick. Okay, because for those patients, it's very important to have a very thorough understanding how blood is flowing through the body. So that's the critical care. Then in structural heart, we actually have three different business units. One of them, obviously is the surgical structural heart, which is open heart surgery, where a cardiac surgeon will perform open heart surgery and replace a patient's worn out heart valve, right, with a replacement product or repair it with a repair product. So that's our surgical heart valves. We also have transcatheter heart valve, okay, or transcatheter aortic heart valve, which is the same thing. The procedure, you replace the valve, a disease valve of a patient, but instead of opening through an open heart surgery, it's through a minimally invasive incision in the groin, and they threaded a catheter and the valve through the artery, right, through the blood vessel into the heart, and deploy the valve. In a similar way that a heart stent is deployed, a heart valve is deployed that way into the aortic valve, right? Then last but not least, we have a very new business, which is not in India yet, right? It's just being launched in Europe, right? And undergoing registration trials right now in US. And this is transcatheter mitral therapy, right? So the same thing, through a small incision in the groin, you put in either a repair product or a replacement into the mitral valve. Okay, so these are basically the portfolio of Edwards, right? And from the hemodynamic monitoring itself, Edwards was a pioneer in hemodynamic monitoring, and this started around 1970. Okay, and in terms of heart valves, Edwards was also the inventor of heart valves, and this was about 60 years ago. So in most, if not all, the technologies that we offer today, Edwards are pioneers, and then this is where we are. So we focus in these two areas. So when I talk about being pioneers and innovation, for example, in our critical care technology, we are the first company that introduced artificial intelligence, right, in the monitoring, right? So one of the things that we monitor very closely is the blood pressure of a patient, right? and you monitor it, real time, and you get continuous values. So our latest technology uses artificial intelligence and machine learning. So it's not only tells you what the blood pressure of a patient is today, it also predicts, what the patient of what's the blood pressure of the patient going to be. So if the patient is going to have a low blood pressure, right, in the next 15 minutes, whether is it in the operating room or in the ICU, this product, right, or this sensor would be able to alert the anesthesiologist or the intensivist that something bad is going to happen to the patient or the patient's blood pressure is going to drop. Uh, in, so that's where we are for critical care. We also have other innovations like our surgical valves. We have, the most advanced valve in the market today, which is what we call the dry valve. The transcatheter valve, we are also the pioneers. We are the inventors of transcatheter heart valves. So that's, in a nutshell, the product portfolio that we offer in Edwards. It's mainly, two areas in hemodynamic monitoring and in structural heart. And in both cases, we want to lead the field, and we pioneer new technologies that the aim is to transform and change the patient's lives.
Okay.
I hope that answers your question.
Exactly. To explain the portfolio, I would come more specifically to the business model, especially the first three businesses that you mentioned, in terms of working directly with the hospitals and other healthcare facilities, or working in conjunction in certain cases with the pharma companies. How is the business model of these specific LOBs?
Okay, so from our business model, obviously, we do have a sales team, right? Which we utilize our sales team actually service our clinicians, right, directly. Whether is it the anesthesiologist, the intensivist, the nursing staff, the cardiac surgeon, the interventional cardiologist. So our sales team call on our customers directly, right, to promote our products, and also to work with our customers in terms of education and all of that, right? In terms of partnership with other companies, we do partner in very specific aspects with some, pharmaceutical companies, where we find some areas of synergy, right? Those partnerships are more directed towards the area of education, okay, whereby, we would partner with, these selected pharmaceutical companies to provide advanced level education to doctors to learn new therapies, new technologies. So that's pretty much the business model from a promotion perspective to hospitals.
Okay, and just an extension of this, in many of the cases, especially for the patient, some of the products, they could be a replacement product or working with conjunction with certain other products, which can be from either a competitive player or some other health player. So, what about the Edwards solutions working in conjunction with products from other healthcare providers?
Okay. So, for this perspective, right, a lot of it is dependent on the doctor, right, who uses the product. And, the products that we offer in Edwards, there are certain, form most of their, I guess, they are meant to be used in conjunction with other products. For example, okay, let's talk about the heart valve replacement, right? Product. If it's a surgical heart valve, right? the doctor not only just use our heart valve, they would need to use sutures from another company to affix the valve to the heart, right? They would use other drugs, to maintain the patient. So that's one example, right? In terms of, say, in the critical care medicine, in hemodynamic monitoring, right? What our products do is monitor and tell the doctor that, okay, something is wrong with the patient or something's about to happen. Then the anesthesiologist or intensivist needs to intervene, right? With, say, maybe some fluids, some medication, and based on the knowledge and the judgment of the clinician, he or she would, basically administer the appropriate medication and the dose of the medication to the patient, right? To reverse and correct the condition that the patient has, is experienced at that time. I hope that answers your question.
Yes. And another aspect you touched upon, and here
Hmm.
the use of AI, where you
Hmm.
say,
Yeah.
and see, ultimately the actual usage of AI is how you leverage the intelligence and what are the
Yes.
insights you gain. But
Hmm.
here, the insights, whatever you gain, is very critical because it's health related. So there
Hmm.
can be no taking chance upon
Of
it.
course.
So, in terms of the sampling of the data, one, the data itself should be of a critical mass, and two, there needs to be certain standardization of the data to achieve better insights. So, how do you ensure both in terms of the scale and the standardization of data so that the insights that are gained is not impacting on the health part of it?
Okay. So, as with anything else, right? In Edwards, right? Uh, we take this very seriously. The products that we bring to market, right? Whether is it the AI product or any other product, they have to be tested extensively, and they have to be. We undergo numerous tests to ensure that they work well, right? And for all of this, obviously, our products are all regulated, and they all have to be approved by various regulatory bodies. In India, obviously, our products are all regulated by CDSCO, and they do undergo a thorough review and approval process by the CDSCO, regulatory body of India, right? Likewise, in US, FDA would do it. In Europe, it's the CE mark, and in other countries, they have their own regulatory bodies. So to ensure that our products are safe, effective, it goes through a very rigorous R&D process. And going through the rigorous R&D process, we ensure we strive to make sure our products are safe and effective. Right? As a result, I think as Edwards, right, we actually do invest about 18% of our sales into R&D to ensure that we're able to innovate with the latest products. Not only that, products that are proven to be safe, effective, and they come with evidence, right? So we make sure that we perform various clinical studies, pre-market, and post-market to ensure the safety and effectiveness of our product.
Okay, thank you. And another thing I wanted to ask about the heart valves and the
Mhm.
other critical unit products, and
Yes.
especially, say, looking at India or other the developing markets, particularly in Southeast Asia and the other markets that which are sort of budget conscious or price sensitive, and the healthcare facilities are twin. There is a huge public healthcare network, where the pricing needs to be extremely subsidized by the government, and there is a private healthcare which is less so. So, in terms of the pricing model, reaching out to both this public healthcare network and the private healthcare network, what sort of pricing model policy Edwards follows?
Okay. So I think Edwards, the pricing, we try to be as transparent as possible to all our, customers. And, we want to make sure that, we price it appropriately for the market. And therefore, in India and in many other places, we take into account many factors when we price our product, right? The cost of living, the affordability, as well as the value that our product brings into to the patient, right? As our products are the most innovative in the market, and that obviously comes with a certain level of price. But we want to make it available to as many as possible within reason.
Okay. And the pricing was one thing. Now, another thing is again, sort of, you touched upon this a little bit, but more in terms of a go to market model. How
Yeah.
do you reach out to both directly as well as indirectly? How do you reach out? How do you go to market, especially with all for respective businesses?
Okay. So I think I mentioned about it, right? So predominantly, well, we do have a sales team, okay, within India, and from the sales team, we directly call upon our customers, right? Physician, doctors, and we do partner with them to educate other doctors. So that's that from that perspective. From a distribution network perspective, we do have a network of distributors to assist us in distributing our products to the hospitals that need the product. That's one arm. We also do have certain hospitals where we go direct and we supply to the hospitals directly. So in a nutshell, like I mentioned, the way we distribute our products first is our sales team will call upon our doctors directly, and depending on the hospital, they can either be serviced directly from Edwards from a distribution perspective, or we do have our channel partners which distribute to those hospitals.
Okay. And another point you touched upon earlier
Mhm.
was 18% of your sales revenues is earmarked for R&D. So
Yes.
I want you to elaborate a little more on the R&D infrastructure that Edwards has and what all are the work being done here.
Okay. So in Edwards, right? So the R&D infrastructure, obviously, we do have R&D engineers, okay, that work for Edwards. In fact, we have it's a huge team, okay, and so their primary responsibility is to perform, R&D work to come up with new products, okay. That's one portion. On top of that, we also have a medical affairs team to, ensure and look at, the utility of our products. So in essence, the R&D funding is, you could say, is earmarked for research of new products, testing, as well as making sure that the products are safe and effective for the patients.
So geographically, how many R&D labs are there Edwards has, and what sort of patenting and other things are done out of these labs?
Okay. So our predominant R&D lab is in our headquarters, right, in Irvine, California. That's basically where most of the R&D happens, right? That's in headquarters. We have a huge R&D facility over there, and that's where it predominantly is occurs, right? That's because we have invested in infrastructure and R&D labs in Irvine, California, for that primary reason.
Okay. Um, and the other arena beyond the R&D, what I would like to understand, especially what has been in the headlines in the last 1.5 year, in
Yes.
terms of the COVID treatment, has Edwards looking to come out with any solutions or products for either a COVID treatment or for the vaccination purpose? Are there plans for any COVID related solutions?
Okay. Thanks for the question, right? And so, in regards to specifically COVID, right? For our critical care division, in fact, I wouldn't say that there are plans. In fact, today, our advanced hemodynamic monitors and sensors do cater for COVID patients, right? Many COVID patients, especially those that are hospitalized in the ICU, they do suffer from shock, right? And our monitoring equipment, will help guide the clinicians to optimize the fluid levels and optimize the patient from a hemodynamic perspective. So, our products today actually do play a role, in terms of helping manage the patient. As you know, COVID patient, especially those that are in hospital, have very complicated disease. They have many issues, and our critical care monitors actually play one part of the role in helping that, right? To manage these patients who are in severe shock, right? They manage, they give a doctor a very clear picture of, for example, the continuous blood pressure, the cardiac output, the stroke volume, and I'm speaking very specific technical terms, but it gives a doctor indication how the heart is working and what's happening, within the circulatory system of the patient, so that he or she can give the appropriate treatment to manage the shock.
Okay, thank you. And coming more specifically to India, I
Yes.
would like to hear a little about the community, the
Mhm.
society of the healthcare specialists that you have specifically for India, and also the network of hospitals. If you can mention some of the major hospital networks who are partnering you in India specifically.
Okay. So of course, we reach out to and we service many hospitals in India, right? Both in the government sector as well as the private sector, right? And most of the major hospitals, if not all the major hospitals, are our customers. So, for example, hospitals, like the AIMS hospital in Delhi and the other cities, Jipmer, all these major hospitals, government hospitals, do use our product and we do service them. From a private hospital perspective, the major chain hospitals and as well as other hospitals like Apollo Group, Fortis, Medanta, NH, we do service, and we do provide our product to all this. So in a nutshell, you know, almost all the major tertiary centers, right? We do service, and they use our product to some degree or other.
And what about the community or the society that you work in India? How does that function and what is its charter primarily?
Okay, could you elaborate more when you mention community? What do you mean?
I mentioned about the ISOC, the community of critical care uh, people that Edwards supports. Uh, SOC, it's this volunteer body, SOC, the volunteer body that Edwards supports in terms of the society.
Okay, I'm not sure I understand your question correctly. Could you maybe rephrase it a bit so that I can answer appropriately?
In terms of sort of evangelizing some of the critical care treatment and amongst the hospitals and amongst the health
Yes.
workers and health specialists, how does Edwards work there in terms of the evangelization part?
Okay. So of course, I mentioned earlier, right? We have our sales team and marketing team, which we sell directly. At the same time, we do have partnerships, right, with professional bodies, like the Society of Critical Care Medicine, the anesthesia, Cardiac Anesthesia Society, the Cardiac Surgeon Society, and we participate in the scientific meetings in through whatever manner that is legally possible for us to do that, to ensure that the doctors uh, in India, right, receive the latest information, and they can make informed decision on the how they will best treat Indian patients.
Okay, and since within this legal frame, you talked about India only last year had in this new telemedicine guidelines,
Hmm.
and especially with a lot of medical legal framework. So, in terms of uh, how Edwards works within these purview of these telemedicine guidelines. What do you feel are the challenges and how a company like Edwards should work within these telemedicine guidelines?
Yeah, okay. So I think, telemedicine is obviously an area that the government is, investing heavily in, and looking a lot to do, right? And for Edwards, this, at the end of the day, our products predominantly are used at the bedside, whether is it, in the operation room or in the ICU setting. From that perspective, telemedicine is not something that is really have a big impact on Edwards per se, because at the end of the day, our products are meant to be used at the bedside of the patient.
Exactly. And maybe the last point is if
Mhm.
from an Edwards perspective, we look at the next 3 to 4 quarters,
Yes.
what will be your primary focus areas that can be in terms of products or in terms of approach or new set of customers? What will be the 2 or 3 key focus areas for Edwards?
Okay. Yeah, thank you. So I think as always, I think not just the next few quarters, right? As always, the major focus of Edwards is, the patients that we serve, right? And in India, it's specifically the Indian patients that we serve. We want to ensure that, we're able to bring, the latest innovation and the latest technologies to the Indian patient, such that, they can have a real impact on their lives, right? And our goal is to transform the way healthcare is delivered for critically ill patients, as well as for structural heart disease. So our focus is always been, to ensure that we try to bring our latest technologies into India as soon as possible, right? When it's first, whenever it's first possible, we will definitely, we will want to register our product with CDSCO, and for CDSO to review our products to ensure that they're appropriate and safe for the patient. And so at the end of the day, that's what we want to do. And to do that, obviously, we also need to ensure that our teams here in India are very well trained, and such that we bring the most appropriate information to our doctors.
Okay,
It's
thanks a
a
lot.
mobile number, too many digits.
Thanks a lot for your time. Greatly
Okay.
appreciate it. Have a
All
good
right.
day.
Thank you so much. Have a nice day.